Hi, I'm Rahim Baumann.
And I'm Denny Kuang, and we're from the Canadian Student Health Association.
We're here to present you our Health Solutions and Action Plan for Burkina Faso.
According to the World Bank and World Health Organization, Burkina Faso is located within the geographical region of sub-Saharan Africa. Burkina Faso is considered part of the low-income group. According to the most recent WHO report in 2016, there are only 0.04 physicians per 1,000 people, with nurses and midwives at 0.565. However, the lack of medical workers is contrasted by the number of public health facilities.
The burden of diseases in Burkina Faso can be measured in disability-adjusted life years, also known as DALYs. A burden of disease can be considered as the current health status of a country compared to what the ideal health status would be. In 2016, the World Health Organization collected data showing that the total number of DALYs of all causes in Burkina Faso was 45,687 years, with a population of over 16.8 million. The top risk factors, in terms of DALYs, that lead to the main health issues in Burkina Faso include the child and maternal malnutrition, lack of clean water, sanitation issues, and air pollution. Some of these risk factors can be attributed to the poor living conditions and low availability of healthcare.
Communicable diseases are the leading issue, with lower respiratory diseases as the dominant cause of mortality. Other diseases such as malaria, diarrheal diseases, meningitis, and HIV and AIDS also contribute to the most common and fatal diseases in the country.
Burkina Faso is extremely vulnerable to malaria. Compared to the rest of its region, it ranks third highest for the malaria mortality rate. Malaria is a vector-borne infectious disease that is considered a medical emergency.
The immense number of lives that have been affected by malaria shows that the prevention and treatment of this disease should be one of the country's top priorities. Data has shown that this disease has taken away 12,600 years of healthy life per 100,000 people, which equates to 160.3 deaths per 100,000 people.
Of those people, women and children are under 5 are the most heavily impacted by this deadly disease. Almost 70% of the children in Burkina Faso are hospitalized due to malaria before the age of 5. This significance is why there is a need for improvement in pre- and postnatal care to avoid and overcome malaria.
To limit the reproduction of mosquitoes, it is crucial to identify areas with high transmission rate where mosquitoes are thriving. Eliminating breeding grounds for mosquitoes would be the first step to eliminating the disease.
With the poor living conditions in Burkina Faso, citizens would need to manage used water and disposing of waste efficiently where the diseased bugs will not be attracted. In conjunction, the usage of pesticides has been proven effective.
Another disease that should be given high priority in Burkina Faso is lower respiratory infections, such as pneumonia and bronchitis. The annual mortality rate due to lower respiratory infections in Burkina Faso is 100.4 deaths per 100,000 people, and the annual years of healthy life, which are DALYs, lost total up to 6,978 deaths per 100,000 people.
Malnutrition is the leading cause of respiratory issues, and women and children are the most severely affected. Tobacco smoke, drug use, and air pollution also contribute to lower respiratory infections.
Malnutrition leads to respiratory infections as respiratory muscle strength decreases, leading to a variety of potential fatal diseases. This issue can be combated through proper nutrition and education on the importance of nutrition and the consequences of smoke and pollution.
Similar to the other diseases we have discussed, women and children are at the highest risk. Exclusive breastfeeding needs need to be promoted, and women need to be aware of the importance of their own nutrition in relation to that of their child. It has been shown that breastfeeding can enhance the antibody response to important lower respiratory and disease pathogens such as pneumonia.
Facilities must be established for pre- and postnatal care to provide a clean and safe environment where midwives would be available, as well as education on safe practices.
Bacterial and protozoal diarrhea is a major concern and cause up to 6.2% of all deaths in the nation. Safe, clean drinking water and proper sanitation facilities are lacking in the majority of households in Burkina Faso, leading to high rates of diarrheal diseases.
One critical way this issue could be faced would be to educate parents and children from a young age on the importance of proper nutrition and hydration. Facilities should be established to provide such resources and education while providing clean and safe drinking water to those in need.
It is also important to continue researching these diarrheal diseases and to continue to provide training to health workers, especially at the community level where care and help can be provided on a person-to-person basis.
The importance of nutrient-rich foods to eliminate diarrheal diseases also includes breastfeeding for the first few months of a child's life. In order for children to grow up healthy, the mother needs to consume nutrient-rich foods herself while also staying hydrated.
It is imperative that these health concerns are addressed in order for Burkina Faso to improve and develop in the right direction, health-wise.
More education should be provided to citizens of Burkina Faso in order to promote health awareness and a clean and safer environment, helping create better health and a better standard of living.
It is important to work towards eliminating the communicable diseases and illnesses, and this can be achieved through vector control, the education of breastfeeding promotion, and the education and knowledge of maintaining clean air and water for the citizens of Burkina Faso.
By doing this, we believe the health and standard of living in Burkina Faso will greatly improve.